Thank you for the invitation and that kind introduction. Can you hear me in the back? All right, great. Well, sometimes these mics only come up to about waist level on me, and I've done some talks kind of like this, but this one's a nice tall one. So yeah, I'm going to talk about transition research. So I've been doing research on transition to young adulthood for about 10 years now, give or take, and we've accumulated a lot of findings. And there's one particular outcome that I like to talk about when I only have a few minutes to kind of sum up the gist of what we've discovered in the past several years using a variety of different national surveys and different sources of information. There's one indicator that kind of captures a lot of other indicators. So the purpose of transition planning when young people who are in special education or in high school, the purpose of transition planning as specified in the statute of the Individuals with Disabilities Education Act is to create stepping stones leading to employment or post-secondary education or both. We have a composite indicator that comes from this national survey data that we use quite a bit called the National Longitudinal Transition Study 2. This was a federally sponsored survey through the U.S. Department of Education. It was about a 9-year study that followed a cohort of approximately 11,000 young people who, at the beginning of the study, were enrolled in special education. And we could break people out by their type of disability, and that study actually followed young people into their mid-20s and was able to tally different kinds of outcomes, like did the person ever get a job since leaving high school? Did they ever go to college? Did they ever go to voc tech school? Did they ever get any of a variety of dozens of different types of services after they left high school? Basically, the study was designed to understand what happens to young people in special education once they leave high school. So we have a ton of different indicators. We created this one composite indicator that we call our disconnection indicator. And it's the percentage of young people who, in the first 6 years after leaving high school, have done none of the above. So they've never had a job of any kind. They've never done volunteer work associated with leading to a job. They've never gone to voc tech school. They've never gone to community college, four-year college, or university. And we found that about 4 out of 10, nearly 4 out of 10, were completely disconnected from both work and continuing education opportunities during these first few years after high school. It's especially acute during the first 2 years after high school, when more than 50% of young people on the autism spectrum were completely disconnected from opportunities for work and continuing education. Because this was a national study of young people who were enrolled in special ed, we were able to compare how young people on the autism spectrum were doing versus other people with different kinds of disabilities. And pretty consistently on this outcome and a variety of others, young people on the autism spectrum were faring worse. Now, so about 4 out of 10 young people are completely disconnected in the first few years after high school. And if we zoom in on that roughly 40%, we find that about 1 in 4 of disconnected youth also had no access whatsoever to supportive services in the first 6 years after leaving high school. They were doubly disconnected. We have a really long checklist of different kinds of services that this survey asked people about, from OT and specialty medical care, vocational services, you name it. And so about 1 out of 4 of disconnected youth also were completely disconnected from any kind of service engagement. Now, another finding that, again, was kind of repeated across a range of indicators that we've looked at over the years, from employment to post-secondary outcomes to post-secondary education to social engagement, is that young people from poor families are consistently faring much worse than their peers from more affluent families. So here we're stratifying this disconnection indicator by levels of parental household income. And we find that the lowest income group on the left is the group earning less than $25,000 per year. The disconnection rate for that group is 64%. For young people who are on the autism spectrum from more affluent families, much lower rates of disconnection. So why am I leading? Where are the ethics there? What's the ethical issue? Well, let's talk about that. So the Interagency Autism Coordinating Committee is a body that is constituted at the federal level, and it's comprised of representatives from major federal agencies that have anything to do with autism. They're citizen representatives, advocate representatives, and scientific representatives. And this body is charged by statute with coming up with an annual strategic plan, which is a set of recommendations on funding priorities for federal research on autism. And they also engage in a number of other activities, one of which is periodically they do this thing called their portfolio analysis. And they comb through all the records of the research that's been funded by both federal agencies and major foundations like Autism Speaks, and they tally it up and they parse it out and they say, well, how much money was spent in a given year on research? And then how did that money get allocated into different topical categories that map onto their strategic plan priority areas? So here we have the most recent one, was for 2012, almost $332 million spent in 2012 on autism research. It's a pretty big chunk of change as far as I'm concerned. And 1% of that was spent on what's called lifespan research, or research into understanding how autism unfolds into adulthood. 7% was spent on services research, which we've heard some about the importance of services today. The 1% number was actually a drop from the previous year when it was 2%. So it's unfortunately it's a downward trend represented in this report. So if we go back here, if we think about this high rate of disconnection, this is how life is turning out in the first few years after high school. And then we look at this. I find that there's an ethical problem there. I find that there's an ethical dilemma when we talk about valuing lives. We've heard a lot of great commentary and insights today about the importance of seeing autism as whole people. Which is, I thank you all for making those points earlier, but it's sad to me that we even have to make those points. So I'm going to expand on this theme a little bit, and I want to talk about cultivating what I call an investment mindset in autism research and autism services. So there's a subgenre of autism research. Well, it's in public health and health research in general. It's called cost of illness studies. So there's a variety. For any major condition, somebody's probably done a cost of illness study. What does it cost society? What does it cost families? That kind of thing. There have been a few of these done in the US around autism. They generally clock in at about the same estimate, that somewhere in the order of $100 to $120 billion a year of aggregated costs to society. So this is things like losses in productivity, expenditures on services, and so forth. And if there aren't great estimates of this, but if you kind of do the math in some of these articles, you can parse out that somewhere in the neighborhood of $12 billion a year are spent on special education services just for young students who are on the autism spectrum in schools in the US. We've got about $1.5 billion was spent on research in the US from 2008 through 2012, which is another number from the IACC. Roughly 320 million per year on research. With the outpouring, oh my gosh, the outpouring, if you're in the biz, you've seen this go up every year exponentially. The number of articles, peer-reviewed scientific articles about autism continues to just skyrocket. So now we have over 4,000 articles a year. So if you're in a PhD program, God bless you. I feel your pain because you're doing that lit review, and the lit review section of every dissertation gets harder for every next generation because there's just so much stuff coming out. Who can keep up with it? But the point I want to make is that we talk about costs. Autism is a cost. It's a problem. It's a cost to society. It's a burden on families. It's a cost to this. It's a cost to that. And the difference, my background is really actually in human services. So I worked in human services for many years in the nonprofit sector, in the areas of affordable housing, homeless youth, supporting migrant farm workers and issues like that. And then I'm a latecomer to academia. I went to grad school in my late 30s. And it was really striking to me, like the narrative, the narrative around some of these conditions it's this cost framing of the issue. And in a lot of other areas, certainly in healthcare and a lot of other areas of human services, there's much more of an investment mindset and investment discussion framing of these issues. And the major difference between a cost and an investment is measuring the outcomes. You know, something is a cost if you have no measure of what the outcomes are. Something's an investment when you have some kind of measure of return. Did you get something for that expenditure of money? So, you know, are there any business people, like corporate executives, bankers, investment people? No, not in this audience. I've done this talk before with business partners, and I always ask the question, you know, can you imagine running a $110 billion a year business with no balance sheet, with no financials, with no data on customer satisfaction? You know, that's functionally what we've got in our country. So from our research, it's clear that positive adult outcomes are certainly possible. They do sometimes occur across levels of impairment, across levels of socioeconomic status. However, poor outcomes are extremely prevalent despite record numbers of dollars being spent on both services and research, despite record volumes of outpourings of research findings flooding the journals. One of the things I think is behind this is we have very few practical ways to measure program performance at a level of individual programs like the local job program or at the population level in terms of state and national indicators. And we really can't invest if we're not measuring results. So I want to talk to you about some of the initial steps that we've taken in our research program, because I feel like what part of the ethical dilemma for me is being trained in a particular way of doing science had not equipped me to think about and grapple with this ethical conundrum about the disconnect between expenditures on services and research and how life is turning out for young adults. So we worked really hard at our center to develop a strategic plan around what we call our National Autism Data Center and our indicators research. And we're really sort of groping and fumbling our way forward with trial and error, but I think we've made some discoveries about a different way to do scientific research, which I hope is shifting the equation a little bit at this ethical level about the kind of research that actually generates some return, or at least allows us to be in a position to estimate return on investment. So I'm going to talk to you about our National Autism Data Center, some of our initiatives around developing web-based information products and our social media outreach. And people always say, oh, what's a data center? And people always think it looks like this. It doesn't look like this. This is, what is this? I think that might be the control. I grabbed it off Google Images. I think it's the control room for the International Space Station. But our data center is a lot more humble. It's a windowless room. With we do have these two supercomputer workstations with dual hex core processors and 32 gigs of RAM, if that means anything to you. It's really exciting. But we do work with these humongous data sets, and many of them have data use restrictions. So these computer stations can't be connected to the outside world. And we believe it or not, your taxpayer dollars are hard at work. We actually get surprise inspections from the U.S. Department of Education. We just had one a few months ago. This guy shows up, flashes his badge. He's the data security guy from the U.S. Department of Ed, and he has to come inspect our office to make sure that we're complying with all the rules around making sure that no one can see the monitor and the screensaver kicks on after 2 minutes and all this kind of stuff. It was quite an experience. So why a data center? It's our belief in public health, because we're a public health research center at Drexel. We believe national level challenges require national level data to inform solutions. And the problem with a lot of the work that we do in our field is it's very inaccessible to people who are in decision-making capacities to actually influence the design of programs and policies. Legislators, legislative staffers, people who run state agencies, people who run large nonprofit organizations, these people are like dying for actionable information. And very little of what we produce as a field in terms of the scientific journal output is actionable information for people who are in those kinds of roles. So we wanted to retool our production, our information knowledge production process to intentionally generate products that were more useful to those target audiences. Oftentimes we focus on one dependent variable at a time in our research, and we focus on one facet like employment or social outcomes. Many of our research strategies and approaches and research products are not holistic. They don't think about the entire person and how their life is turning out. And oftentimes the production of scientific research output is not, it's done in response to, quote, gaps in the literature. And the gaps in the literature approach to training doctoral students in terms of how to find a topic of interest or that's useful is not necessarily map on to the world of policymaking and program planning in the front lines of service delivery. So oftentimes the scientific output that we generate is not strategic or relevant with respect to policy or programming. All right, we kind of talked about this. I'm going to accelerate a little bit here. So at our center, the overall concept is there's a lot of data out there. We've been slowly cataloging and collating and gathering together dozens of different national surveys and sources of data. Most recently, we're going through a whole data use agreement with the Social Security Administration. We're, I hope, weeks away from getting access to almost 2 decades of SSI enrollment data, which will help us understand income support and benefits for people with disabilities, including those with autism. But we really are trying to create kind of a stream of information products that are accessible, understandable, and impactful for policymakers and program designers. So we have a website. It's not your standard sort of academic website, I hope. We do focus groups every few months, every time we put out a major flagship product. Right now we're going through a whole redesign of our website, and we've assembled an investigative team. We're doing focus groups with legislators, legislative staffers, interviewing people about how they use information, how they react to different drafts and different versions of the data products that we produce. And a lot of what we do revolves around this idea of indicators research, which is pretty commonplace in public health and sociology and demography. If you've ever driven a car, you know what an indicator is. Your dashboard is full of indicators. You've got a speedometer to tell you how fast you're going. An odometer tells you how far you've gone. You've got your navigation panel. You've got your gas tank indicator. You've got a variety of indicators to tell you if you're on track to get where you're going, how much fuel you've got in the tank to get there, if there are obstacles in the way, the health of your vehicle as you're moving forward in time. And as of a few years ago, really where we stood in terms of indicators research for autism, and indicators research is pretty commonplace, say in cancer or other topics in health and public health. A few years ago, this is kind of where we stood in the field of autism in terms of our indicators research. We were driving down the road without having much information and feedback loops that can tell us whether we're moving the needle on these outcomes. And this phrase, moving the needle, I love that phrase because I started hearing that around 2006, 2007 at national meetings. And being a sociologist, I heard that, the first time I heard that at a meeting, it was this the think tank on adult outcomes. And I was like, that's awesome. I love that idea. Where's the needle? Where's the gauge? And people are like, oh, no, it's just a metaphor. I'm like, why? Why is that a metaphor? We should have gauges. We should totally have gauges. Let's build those gauges. So we've been doing this for a couple of years now. We meet routinely with the GIO, with the Congressional Autism Caucus, the staffers. I do a lot of work with different state agency directors, particularly now with the VR system after last year's passage of the WIOA. A lot of states are trying to figure out how to retool their policies to comply with a federal mandate that at least 15% of each state's VR vocational rehabilitation budget now has to be dedicated to transition age youth. And states are rushing to try and figure that out. It's a real opportunity for us to step in and influence that. We actively court media coverage. We do a lot of outreach to the media. We're trying to build awareness about these issues around transition to adulthood. And we've had great traction with major outlets. We've built up our social media following. We've got almost 11,000 followers on Facebook now. And we have scientific impact. So even though these are a different kind of research information output versus your traditional peer-reviewed journal article. Our last year's National Autism Indicators report, which focused on transition outcomes, was recently selected as one of the most 20 impactful studies of 2015 by the IACC, which we were very gratified by because we get a lot of pushback saying, well, that's not real research, you know. And this helps sort of increase the credibility of the work that we're doing. We really strive to go across a range of indicators to paint a holistic picture of how life is turning out. We look at things related to continuing education, participation in the community, friendship, employment, volunteerism, living arrangements, safety, healthcare transitions. We don't have anything on sex or sexuality. Got to add that. I made notes. Very important. We have a range of outputs. We do these big geeky reports. We do 2-page fact sheets. We do infographics. Again, we're really trying to be in the business of doing a different kind of research that's much more actively engaging with the media, with legislators and policymakers. So we've got some next directions that we're going in. I mentioned our work with the Social Security Administration and the VR data. You know, we hear a lot of stories about how difficult it is. So for those of you who don't know, SSI is it's an income support program for people with disabilities. And if you qualify, you know, the benefit ranges usually somewhere between $200 and $500 a month. It's income support. It's meant to help prevent people from becoming completely destitute. It can be used for things like rent and food, the basics of daily living. The eligibility determination and application process is notoriously extremely difficult. So we have one research project going now trying to do some mixed methods, qualitative and quantitative work, trying to understand where that process is going astray. Social Security Administration is very excited about working with us because they're trying to make their application process more autism friendly right now. But we have a lot of people sort of cycling in and out of eligibility for these benefits, and it becomes very stressful for families, much less the people with autism. But we also we don't just look at adult issues. I also have a background looking at age of diagnosis and disparities in diagnosis. I was really excited to hear Catherine's talk this morning. And we're slowly trying to put ourselves into the position of having baseline data across a range of topics that will actually let us begin asking questions about whether things are getting better at the population and societal level. So things like age of diagnosis is one of those few topics where we're starting to accumulate repeated measures over time. We can begin asking, well, is that age of diagnosis, is that going up or is it going down? We're a few months away from getting our hands on data from the U.S. Department of Education, which is a follow-up study to the NLTS2. It's the National Longitudinal Transition Study 2012. They redid the whole sampling process, and they collected a nationally representative sample of adolescents and young adults who had been in special education. So hopefully by next year this time, I'll be able to tell you whether the employment rate has gone up or down for young people who are just out of high school, whether the rate of people going to college has gone up or down. Because these are the kinds of questions that families and policymakers want answers to. And these are the kinds of questions that I think are really useful for clinicians to be hip to, because a lot of families are going to be asking you. And I think helping families with this anticipatory guidance to understand what they can expect, but also, gosh, I'm sorry, I gesture a lot when I talk. And I'm not even Italian. And my Italian friends joke me, you should be Italian. So the thing with families, you know, the reason we're here today having this symposium is because of families. So families, and there's a historical narrative about the history of developmental and intellectual disabilities where families have repeatedly put these conditions on the map politically, medically, ethically, in terms of funding for research. And really, we're riding, you know, almost a 20, 25-year wave of family activism and now self-activism around autism issues that have put these issues on the map. And the reason we're here today is because that's been a phenomenally successful social movement in the past 20 years to raise awareness and to raise money. So I think it's actually important as clinicians, when you're working with families, if opportunities arise, is to educate people about the fact that we're here because of a parent movement. And if people tend to cycle in and out of these episodes of advocacy and activism, and I think as clinicians, you're in a great role to be letting people know that we're here because previous generations of parents and disability activists got organized and lobbied for every benefit that we have today is here because somebody lobbied for it at some point and succeeded. So getting this kind of work funded is very hard. One of the reasons I went to Drexel, I had been at another place previously where I had a very difficult time building the case internally to do philanthropic fundraising around this indicators research, because it wasn't seen as like standard NIH-style research, and it really was kind of frowned on. It's very difficult to find funding for this more applied kind of research, and yet every indication we have from our interaction with legislators and program managers, agency leaders at the state level is that they really value this kind of work, and I believe that it is work that matters. And I think there's an ethical dimension into how we think about funding priorities. And if the frame of what's meritorious in terms of federal research, if we continue down this path of only 1% of all research funding going to adult issues and only 6 or 7% going to services research, I predict we're not going to move those needles, metaphoric or otherwise. You know, we're going to continue having this conversation 10 years from now where we're stuck in a really lousy outcome zone in terms of these national indicators. So the take home, it's pretty simple. If we want to move the needle on young adult outcomes, we really have to build gauges, and we have to continuously measure at both the program, the agency, and population level. And we have to couple that with continuous improvement practices rather than a search for static manualized practices, particularly around things like employment. You know, employment is my favorite example. Having worked in the social services sector, the world is moving rapidly, and the idea of creating a static manualized intervention that's going to help people get a job, we're going to work for 5 years and do an RCT, and we're going to perfect the approach to help people get a job, and then we're done, right? It just doesn't make sense to me because the world is moving fast. The kinds of jobs that are available vary from community to community. The kinds of companies that are willing to step up and help vary from place to place. The kind of work that's available now is different from the kind of work that was available 10 or 20 years ago. We have in healthcare, certainly here at Seattle Children's, we have an embrace of ideas of continuous performance improvement practices. And those ideas, those values, those practices have been very, very slow to catch hold and take root in the world of autism services, particularly for adults. And I think we, certainly in the medical field, if you have a background in continuous quality improvement, if you want to go volunteer on a board of a local nonprofit that does employment for adults with disabilities, try and be an advocate and an ambassador to take some of those ideas and some of those tools that have served healthcare so well. And let's bring those ideas and those tools into the services sector where programs generally do not have the tools and the ideas and the resources to do continuous improvement that's based on measurement, continuous experimentation, and feedback. So we have a vision statement at our research program that people on the autism spectrum are valuable members of our communities. They have roles to play, dreams to achieve, and contributions to make. And I think this speaks to some of the other comments today of the importance of viewing people on the autism spectrum as people, and they have lives. And we need to think at that level of holism when we're talking about research, and how do we connect the dots so that people aren't just research participants, but they're partners and people that we care about. And last but not least, I feel that if we can reframe some of this conversation, and if we can begin getting better at measuring outcomes, both at the population level, at the state agency level, at the local program level, I think we can start shifting the conversation so that we're not just talking about the costs of autism, the burden of autism, but we can actually talk about investment in different kinds of strategies and understanding where is our return on investment. Are we going to get a better return in this employment program versus that employment program? But we can only do that if we start measuring results and outcomes. Thank you so much for your time today.